Does the United States really have the worst health system in the world? In a recent ranking, it didn't fare too well. I'm Dr. Chad Swanson. I'm an emergency physician, and I'm on a journey to understand and transform our health system. The Commonwealth Foundation provides an annual ranking of a number of developed countries, and the United States ranked last. A few comments about health systems and rankings first. When we talk about the health system, we're often referring to the health care system, so doctors and nurses and hospitals and clinics, whereas the health system technically is all the factors that influence our health, ranging from exercise to our diet to social interactions. And the health care system, so the care that I provide as an emergency physician and drug medications, only accounts for 5 to 20% of our modifiable health status, so our health status that we can change. So that's one important factor to keep in mind. The second is that the people that work in the health system and the healthcare system and the public health system and the pharmaceutical system, by and large, the ones that I know are wonderful, brilliant people who are trying to do the best that they can, but we've all inherited a system that is flawed. Having said that, we all know that we can do much, much better. No, the United States does not have the worst health system in the world. There are many other countries that have much worse health systems, but when compared to similar countries, developed countries, we fare much, much worse. Let me share a few of the slides from this report. This first one has high performance and low performance of health systems. And this performance is based on factors like access to care, care processes, administrative efficiencies, equity, so fairness, and health outcomes. So there are a number of countries, 10 different countries, that are all close to each other in how well performing their health systems are. There's Australia in number one, and New Zealand, and Sweden, and Canada, and Germany. And then the United States is down here as an outlier. So clearly an outlier in health system performance. Another figure that they have here is healthcare spending as a percentage of GDP. So again, we have a grouping of the countries in their percentage of GDP that's spent on health care. And it's right around 10 to 12% of GDP. And then of course the country up here that is the outlier is the United States, spending up to 17% of GDP on healthcare. So we are spending by far the most, and we are performing by far the worst. It should be the other way around. So a final figure that just shows all of the countries when we compare performance to spending, and the United States is an outlier. So as I think about the history of our country and the values of our country, I'm saddened and just feel that we can do much, much better with our health system. I think back at victories and successes that our country has gone through, from World War II to the Civil Rights Movement to even landing on the moon. And I just see times that we come together and make significant changes. And I can't think of a cause that's more important than the health and well-being of our people, by decreasing suffering and decreasing cost and bankruptcies. And our national security is being threatened by the cost of health and healthcare. So I hope that by producing these daily videos that I'm contributing, even in a small way, to the conversation, that in some way I can be informative or inspiring. And tomorrow I'm going to share 10 specific things that I think can be done to transform our health system to be the best in the history of the world. I'd love your comments, suggestions, criticism. Thank you.